And welcome back to the Factor Uncensored. Peeps, we are almost there. The time for the pandemic to be declared over could be on the horizon. Keep your fingers crossed. We pulled in Dr. Danish Ali from Archpoint Pain Institute on the Factor. I hear endemic, and my mind went straight to thinking this is going to be totally over, but that's not the case.
You know, I'd like endemic to mean the end, but we know it doesn't mean that.
That is correct, Isaiah. It does not. What it means and what it tells us is that, Isaiah, this virus is becoming static. And what that means is that we're not seeing those high cases of breakthroughs that we were with the Delta and the Omicron variants. And so it's static, meaning that we're seeing these cases happening, but we're not seeing a high trend. We're not seeing those significant outbreaks that we were. And so that is all good news. This virus will become like the flu virus, Isaiah, where every year it may show up more at a certain point of time, most likely probably in the more winter and cold season. And then it's going to be one of those that we're going to continue to get vaccines and boosters over the course of time as well.
So like when we say it's a flu season, at some point, they're going to gather the numbers and say, okay, now this is COVID season.
That's correct. And I anticipate, Isaiah, that the COVID and the flu season will run together because of the times that they're what we've seen for the past 2 years in terms of when they're at higher chances of becoming infected. And those are the winter months, similar to what we see with the flu. So I anticipate that they'll be kind of commingled together in terms of their infections.
Now, when we talk about the numbers stabilizing, like we have seen or we are seeing now, is there a chance that those numbers will spike again?
There is, Isaiah. There's always a chance that we may see another variant. There's still that subvariant that has been out there. Thankfully, it has not shown those high numbers that we did with the Delta and Omicron. And so I anticipate that we'll continue to see different variations of this, just like we do with the flu every year. We'll see different variations of it. We do not need to let our guard down yet, Isaiah. I think we should continue to encourage things that we have been encouraging already with the mask, with the socially distancing, those sorts of things, just to make sure that we can prevent another outbreak from happening in those numbers rising again, or, worst case scenario, this becoming a pandemic again.
So now an immediate concern. What about the cook-off and the rodeo coming our way here in the Houston area? When it shut down 2 years ago because of COVID, that's when it got real for us here in this city.
Should we be concerned when we go to these events? All of them obviously are outdoors, except for maybe the concerts that will be inside of the arena, but outdoors, should we still be wearing masks or taking our hand sanitizer, or we're free to just go out?
Yeah, Isaiah, it really becomes a personal choice. I know we've chatted about this before as well. Really comes down to the fact that, listen, I mean, if you've got other comorbidities, if you've got high risk factors, you've got diabetes, high blood pressure, lung disease, you're above 50 to 55 years of age, that puts you in a higher category to get infected potentially and become ill from it. Those are all reasons, and those are all things that we need to consider in the back of our minds. And so I think people need to make their own judgments in this, Isaiah. And I think that they need to also realize that they may potentially infect somebody else, and that somebody else may not have as good of an immune response as another person would. Thankfully, a lot of these events that are happening at the rodeo will be outdoors. People will be practicing being out in the open. The time frame that it's happening as well, we're seeing those numbers of cases improve as well. So those are all good factors. I want people to use their own wise judgment to come up with their own whatever scenario they want to do and what they want to use in terms of their mask or not. I do definitely encourage this as much as possible, and I think the medical community as a whole recommends it, but it's really a personal choice, I'd say.
All righty. And really quick, in the last 15 seconds we have here, hospitalizations, you're on the front line. Have they gone down or are they stabilized as well?
They are stabilized right now, Isaiah. What we're seeing in the hospitals is those cases that are coming in. Those are the folks that are very ill, meaning those are the folks that are spending a lot of time in the hospital. They're being intubated. They're spending a lot of time getting deconditioned and sick. And for that reason, they're spending more times, and that's what we're seeing. We've seen a decrease in the amount of just the colds and the flus, those sorts of symptoms, because a lot of people are going to other places to get checked out, which is good. But again, we're really seeing those sick folks still coming in, Isaiah.